Good afternoon, everybody. This is Stephanie Hall, and I am with the ESRD NCC National Coordinating Center. I just want to thank all of you for joining us today for our professional education webinar event. This is our last one for 2020. So thank you for joining us. And as you know, these events are being held in partnership with the Centers for Medicare and Medicaid Services. The series of events feature guest speakers from around the country sharing how they or their organizations they are with are coping with COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted to the NCC COVID webpage within 3 business days. Can I have the next slide? So just a little bit of an agenda. We sort of talked about what the call was about. We actually have 2 speakers today. We have Sini Tharu. She's with Fresenius Medical Care in Bollingbrook, Illinois. And we also have with us John Valencia, Transplant-Strategic Outreach Consultant with Rush University in Chicago, Illinois. Their topic today will be on the importance of kidney transplant and the referral process during COVID-19. All participants, as they enter into this webinar, are put on mute. However, we do want to hear from you. We do want you to submit your questions during the presentation. If you have any questions for our speakers, we do want to hear from you. So please submit any of your questions via the chat or the Q&A panel. Next slide. So what's this call about? We have these calls. We have twice a month calls on various topics for professionals. We hear from different stakeholders and peers in the ESRD community about how they are adapted to the COVID-19. Many of our speakers, they share examples and provide real world strategies for facilities to use. Next slide. So let me go ahead and get started. Like I said, we have 2 speakers. I'm going to go ahead and introduce them both. Our first speaker is Sini Tharu. She's a licensed social worker with Fresenius Medical Care in Bollingbrook, Illinois for the last 16 years. She works with patients and families providing education on coping and adjusting to end-stage renal disease. We also have with us is John Valencia. He is the Transplant-Strategic Outreach Consultant for the Rush University Medical Center in Chicago. He's been there since 2009. He is responsible for educating the community about the importance of kidney, pancreas, and liver transplant. We're very happy to have both of them with us here today. I am going to turn over the presentation to Sini. She is going to start. So Sini, go ahead. The presentation is all yours.
Thank you, Stephanie. So as Stephanie mentioned, my name is Sini Tharu, and I've been working at Fresenius Kidney Care for the past 16 years. The last 14 years of it, I've been at the Bollingbrook Dialysis Clinic. So the population that I work with are older adult to senior patients. I do have some younger population in the 20s, but most majority are older to senior. So as mentioned, the topic that we're discussing today is the importance of kidney transplant and referral process during COVID-19. So kidney transplant in general is an area where some patients have concerns pursuing, either it's related to their age or medical conditions, or they're just satisfied with dialysis. And then you add a pandemic to it, and their concerns rise even more. Next, please. Next slide. So as Stephanie mentioned, so today John and I, we will be speaking on how this has affected both the dialysis centers as well as the transplant centers. So our objectives for today is identifying patient concerns and fears that are related to kidney transplant during a pandemic, understanding the benefits of having patients get on a transplant waitlist during COVID-19, describing the impact COVID-19 has had on the transplant referral process, and describing how a transplant center educates dialysis patients during a pandemic. So the first portion of it, I will be discussing it from a dialysis perspective, and then John will be talking about from a transplant perspective. Next, please. So before I go into the roles and responsibilities in patient education and referral, I just want to give a little background information that this is a standard practice for kidney transplant referrals that's been defined by the transplant community as well as Center for Medicare and Medicaid Services. So the ESRD conditions of coverage also requires that dialysis facilities track results of each patient being referred to a kidney transplant center. So in terms of the roles and responsibility with pre and post COVID-19, so patients are educated on kidney transplant within the first 100 days of starting dialysis, and then minimum annually thereafter. Of course, we can do it as often as during our monthly rounding with them as well. This education is documented also in the the medical records. This process is also tracked within our clinic. We get reports on patients that are on the transplant list, those who are referred, etc. This discussion also happens during our quality indicator meetings, which takes place with the nephrologist, the care team, and this is done monthly. And any problems that causes delays in transplant evaluation is also addressed. Next slide. So communication is key between the transplant center and the dialysis center. This should happen at least annually, and especially when there is any type of change, whether it be in their health status, mental status, insurance changes, or anything pertaining to their health. So this communication ensures the continuity of care between the transplant centers as well as the dialysis centers. Next slide, please. So in terms of the education, so we do discuss that kidney transplant is a modality choice for the patient. We talk about all the benefits of being on transplant versus being on dialysis. Also, patient responsibility. We talk about how important it is for patients to make sure, they are compliant with their treatments, with their medication regimen, making sure they're following up with all their appointments and visits with the transplant center, and that any problems are being communicated also with the transplant team. Family responsibility, family support is also a big factor in this process also. Next slide, please. So in terms of the education, we do talk about insurance and finances. Not all insurances are networked with the particular transplant center. So we discuss how insurance and especially finances with regarding medication, because they might have high copays and deductibles. And the transplant centers will go further into details about it, but this is also part of the education piece. As mentioned, we talked about compliance. We inform the patients, it's important that they do come to all their treatments and complete their full treatment. The transplant centers also require sometimes reports to be sent regarding their compliance also. And then pre-COVID, we were having in-person lobby day education where various transplant centers would come and provide face-to-face interaction with the dialysis patient. Next slide, please. So now we're talking about post-COVID-19 education and referral. So in terms of the education and documentation piece, they have remained the same pre and post-COVID. The changes that have occurred is that Fresenius dialysis facilities are not able to conduct the face-to-face lobby day education in person. So the transplant centers have come up with different ways where education can still be promoted to the patient. So they've come up with virtual lobby day education. So Rush University is conducting virtual lobby day. John, who's going to be talking more about this during his presentation. The other transplant centers are providing education either through contact phone calls, flyers and brochures are being sent about their virtual education, which patients can initiate either through phone call or video call. The list of all the transplant centers are provided to the patients. And some of the changes also with the referral process is that patients can either complete a paper application or they can contact the transplant centers through the phone. As we talked about, they can conduct on virtual lobby day education and also through QR code. QR code is an online application that can be downloaded using their phone. John will also speak about this during his presentation since Rush is doing this for their referral process. Next slide, please. So there have been some fears that patients have expressed about wanting to pursue even a kidney transplant during this time. They're afraid of following up in their referral process, going to their appointments, doing their workup. Some of them don't even want to get a transplant during this time. There's a lot of fears of being exposed to those that potentially have the virus. So there's a lot of mixed emotions that are going on with patients about wanting to do this. Next slide, please. Next slide. So as a social worker, my job is to encourage, patients about kidney transplant that it's still being the preferred option to make sure, they're maintaining their optimal quality of life and superior health outcomes. We do talk about, their life expectancy is much better on transplant versus dialysis. Also, we talk about the amount of hours that are spent on dialysis, the amount of time spent and, the hours can be reduced with having the kidney transplant. Next, please. So even though we've had all these fears and concerns, we've had successes also during this time, especially at my clinic at the Bollingbrook Dialysis Center. We've had 24 patients that have shown interest in pursuing kidney transplant. Either patients, are wanting to initiate by making phone calls, wanting the list, or completing paper applications. And those that are comfortable are doing it also through the QR code on their phone. We also have several patients that have been listed and as well as in the process of getting listed for transplant also. Also, another great news is that we've had 3 patients who received kidney transplant during the pandemic. Next slide, please. So now I just want to touch on a couple of scenarios of real life situations that I've encountered these past few months. So the first scenario is Mr. A. So Mr. A is a 72-year-old Hispanic male that's diagnosed with end-stage renal disease secondary to diabetes mellitus due to underlying condition with diabetic nephropathy. So this patient actually tried to get listed for kidney transplant before, but he was rejected due to his age and also a health condition. So as a social worker, I tried to encourage him to pursue transplant again. I provided him with the list, but he wanted to pursue it at Rush University. The patient was concerned to pursue transplant because of his age and especially with COVID-19. Next slide, please. So my question to you all is, do you think the patient initiated the kidney transplant due to COVID-19? Next slide. And the answer is yes. Next slide, please. So yes, the patient decided that he still wanted to pursue kidney transplant even though he had concerns with his age and worries surrounding the virus. Patient was not very comfortable using the QR code, but he wanted to speak with the transplant coordinator. And then a paper application was faxed to our clinic. The patient and myself, we worked on the application together. The application was faxed and sent. And the great news is that he had an appointment coming up towards the end of the month. So that was a great illustration. Next one, please. So patient number 2, scenario 2 is Mr. J. He is a 53-year-old Caucasian male that was diagnosed with hypertensive chronic kidney disease with ESRD. So this patient, he wanted to initiate referral at Rush University, but his insurance was not in network. So the patient and myself contacted his insurance and found out that another transplant center was in network. But then the patient, he was hesitant to follow up with initiating the referral due to the pandemic. So he verbalized that, he had saw one of his close family members who was COVID positive, and he saw the effect of the virus on this individual. As a social worker, I did try to encourage him to still pursue the transplant, and also talked about the safety measures, protocols that transplant centers, they put in place. Next slide, please. So my question is, do you think that the patient initiated the process with his reservations with COVID-19? Next slide. And the answer is no. He did not want to pursue it at this time. He said he was going to wait until either there was a vaccine available or when Illinois had a better control with COVID-19. And he told me that he would let me know when he was ready to pursue. Next, please. So the last scenario I have is patient number 3. So Miss C is an African-American 56-year-old female that's diagnosed with ESRD type 2 diabetes with other kidney diabetic complications. So this patient, she was on the category waitlist for transplant. She received a phone call from the transplant center saying that it was available. However, the patient, she rejected the initial phone call from the transplant center, she was afraid of being hospitalized, complications that could relate to both the surgery as well as with COVID-19. So she didn't want to follow through with it. So when we as a dialysis center heard about it, the team at Bollingbrook, as well as myself as a social worker, and the patient's family encouraged patients to pursue kidney transplant. We talked about all the benefits that she could get from having a transplant. And then patient ended up miraculously receiving a second phone call the next day. Next slide, please. So how do you think the patient responded to the second phone call that she received from the transplant center? Next, please. So great news. Patient was encouraged by the team, by me as a social worker, and her family support, and enabled her to accept that kidney transplant. She went on to receive it, and she did amazingly well in the hospital, and she's doing great even during the time of COVID. Next slide, please. So in summary, we see that COVID-19 has radically changed some aspects of patient education and referral process in the dialysis setting. We know that in-person education has been halted, due to the circumstances. However, the transplant centers and the dialysis clinics are working together to establish, different ways, different methods of education and referral process about the benefits of pursuing transplant. Some elements of the education remain unchanged as I expressed in the presentation. And then the new goal during this pandemic is identifying fears, addressing the fears, concerns patients have, due to COVID-19, and helping patients overcome their fears and apprehension. So this is something that, it's important that we need to help our patients with that. And the main objective for transplant centers and dialysis centers is to support our patients with potential, kidney transplant. That's pretty much it from my side of the presentation. John, he's going to be speaking more about it from a transplant perspective. And when John talks about the virtual day lobby education, that is something that at Bollingbrook we are interested in, and we're hoping to, set that up towards, hoping in the new year. Thank you so much for your time. If you have any questions, please ask me towards the end of the presentation. Now I'm going to turn it over to John. Thank you.
Good afternoon, everyone. My name is John Valencia. As Stephanie mentioned earlier, I'm the Strategic Outreach Consultant for the Rush University Medical Center in Chicago. Some of you who've been to Chicago, you may have actually driven past our institution or if not seen it. Today I'll be talking a little bit about the Transplant Center's perspective on educating dialysis patients during this pandemic. Next. So before I start off, I want to give you a little background of my role and responsibility. The key piece to my role is to educate patients at their dialysis unit, or if not within the community, about the importance of kidney transplant. And Rush, as you'll see here, Medical Center, is if you look to the right, is chronologically you'll see the age of our institution. We're an institution dating back to 1837, and if you look to the left is the newer building. That's our newest hospital that was built in 2012. And you won't be able to see it, but to the left of that new building is that we're building a new professional building where we'll have oncology and also neurology. Next, please. So Rush has approximately 824 beds, including a children's hospital. We serve the west side of the community of Chicago and the Chicagoland. We also have two other hospitals within our Rush Health System in the suburbs. If you were to draw a line from east to west in Chicago all the way to the western suburbs, we have two other hospitals going approximately 40 miles east of the downtown area. Next. So COVID-19, this is something that I do recall that the last in-person lobby day that I had at a dialysis center, which was March 13th, the panic that we all had with regards to what is going to happen to ourselves or even our families, but also, which most importantly, is our patients, with regards to what is COVID-19 or how COVID-19 is going to affect us. I'm going to talk to you a little bit about our protocol, what we've enacted here at Rush. But just before I discuss that, I want to kind of give you a sense of how our institution has actually been a hub to deal with COVID-19 patients. It's something that our governor and also city officials we were the go-to hospital to go with regards to any viruses and illnesses from the perspective of hazardous attacks that would be happening here in Chicago. But COVID-19 was another virus that we were actually equipped to handle. So what we did here in our specific clinic is that we went into, which this may be a protocol that you have specifically with your own clinics, is that we don't allow that one person into the clinic for our initial follow-up, our initial and also our follow-up, and there's no children allowed at our medical center. As things actually progress in the direction that will allow patients to bring a visitor, but right now we're at a current phase of phase 3. Which is, we've seen a spike in the COVID-19 viruses up and down due to the holidays, but we've seen a retraction. So once we retract, that this protocol may change. Part of the other piece of our protocols is our mask protocol. Masks must be worn at all times in the exam room. From the point that you enter, you'd be surprised. A lot of staff that walk around outside of the buildings, you'll see them still with their mask on because we're pretty much trained already as to wear this mask all the time. So another piece to this is social distancing. Is in our waiting room, we've actually taken the seats out, so we have a 6 feet distance. We allow patients to come shortly before their actual time. We want them to stay down in our main lobby, so we don't have any crowding of patients coming in through our front door. Our transplant education, which I'll give you a little bit more information, but regarding transplant education, all patients who come for an initial appointment for transplant will usually typically have a group education. But in fact, what we're doing now is that we're doing this education individually in a PowerPoint presentation. We allow patients to see this presentation, Spanish and English. Next. So typical protocols. Our main lobby, there'll be a temperature check as soon as you walk into our building. There's a second temperature check inside our clinic, the typical screening questions, cough, fever, and if someone does come back as positive or they actually state that this is a yes, they will be sent to the emergency department or if not, be self-quarantined. Once a patient is seen to be positive, we'll reschedule their appointment. If somebody who's tested positive and wants to return, they actually will have to bring in a negative 19 COVID result. So what hasn't changed? We still continue to see patients for kidney transplant. There's no clinic closures. We're still working up all our testing. It hasn't been affected, so if a patient needs a stress test or an x-ray, or if not an ultrasound, they can still actually get that done. All waitlisted patients have to be seen annually, so that continues. Next. So regarding impact on our education for myself regarding outreach and the referral process, here are the major ones, the major impacts. There's no group class education in clinics. We have a restriction, as Sini has mentioned, is that there's a no visitor policy for dialysis units, so we're not allowed to have in-person lobby days. So that has changed overall. So dealing with the social distancing and also the transmission risks. Major impact is that patients have fear coming to our institution due to the fact that they hear COVID. They may see our institution on the TV explaining that the rise in COVID cases in the Chicago area or Chicagoland area. So our net effect, what has happened, is that we've had a reduction in patient education. Myself going out to dialysis units no longer exists. There's also been a reduction in patient referrals and also the reduction of patients getting worked up for transplant evaluation. So in summary is that this has been a delay for patients to be worked up and listed for renal transplant. Next. So what had happened in between that COVID pandemic panic at the same time the virus spreading throughout the entire country and the world is that I started thinking about this and saying, how can I actually continue to do my day-to-day work of in-person lobby days with this pandemic? Well, I can't. So what other option do I have? The idea came across a virtual lobby day is since we all have gotten into the point of doing telemedicine at you may have been doing this at your dialysis center, if not within our healthcare system, is that our physicians kind of hit the brakes and said, all right, we have to still reach our patients. We don't want to put them at risk. What are we going to do? So we actually started reaching out to all our patients that had appointments and saying, let's do this telemedicine, telehealth. And I said, hey, this would be a great idea for us to do education via a virtual platform. The idea is to utilize our technology to bridge the gap of providing transplant educations to dialysis patients. We all know everyone, usually in your household or day-to-day individuals that you run into, do have cell phones. We do know that not everyone has a tablet, if not a computer. I was thinking back of my father. My father is 85 years old, and the fact that he always has a cell phone with him, my mom also does too, and she's in her 80s, is that this could be an opportunity for us to potentially reach out to our patients instead of us waiting by the phone and waiting for a patient to give us a call. So our aim was to provide kidney transplant education via telephone or if not via video call. And also we needed to put into perspective is that because we know this virus could be transmitted through touch, when you touch an item and someone else is there, or through the air. We all know that, and this was something, how are we gonna approach our patients that normally fill out a paper form? Maybe they'll have the fear of doing this. Is that I will go into the explanation of our QR code, which allows patients to do our online appointment registration via our website. Next, please. So what we did is that we launched a pilot is to see how can we include this virtual platform amongst our dialysis community. As you can see from the dates of August 27th through the 28th and also the beginning of September, you kind of question, well, what took so long? What had happened is that I actually was a patient, or actually I ended up becoming a patient that was affected by COVID-19. So this gave me a little bit more time to kind of think things through, but at the same time has come up with this idea of the virtual lobby day concept. What we did is that we did this at 2 dialysis centers in the Chicagoland area. What we learned is that patients who were interested, and I'll go into specifics of what the virtual lobby day consists of, but what we learned through this pilot program is that patients were open to the idea of receiving information via telephone or if not video. Also, older patients, which was quite astounding, is that patients that were older wanted to see more or less the video interaction, which that for me was something stunning to me, because I said, would older patients want to, do they understand the technology? Would they want to do this versus over the telephone? And in fact, that we did learn that video was something that they were interested in. Patients also enjoyed and liked the QR code opportunities to actually be able to fill out a form on their phone and not have to actually fill out using a pen, a paper application. So what we did see there was some rooms for improvement is how do we engage more patients to be interested in this concept of the virtual lobby day, and also accessing patients via video. We first started off with WebEx. Not everyone had access to WebEx. That was a concern for us. So what we did is we made a few changes. One was to allow patients, or allowed staff to engage their patients to sign up. Instead of a week, I gave them 2 weeks. And we included in this engagement of patients is that we included an informational patient handout. And I'll show you an example of it later in the slides. And we also offered the video access via FaceTime, WhatsApp, Zoom, and WebEx, which you'd be surprised, a lot of patients and family members might have access to these different apps. Next, please. Next. Great, thank you. So here are the elements of a virtual lobby day. So if you envision an in-person lobby day, I'm going to give you the flip side of the virtual lobby day. So in-person lobby day is where I would set up a table in the lobby of a dialysis unit. I would engage all patients that came through for the treatment time and their family members in the lobby of the dialysis unit with discussions of questions they had, misconceptions, just general information of how Rush works as a transplant center, dealing with insurance issues that they may have had in the past with other transplant centers. Is that, in a nutshell, is what would happen in a typical lobby day. Now, since we're not able to do this in-person lobby day, the virtual lobby day stems from the same concept. But what it would be is that this concept of a virtual lobby day will be myself reaching out to a patient via telephone or if not video. So here are the elements of a lobby day. If you can put on your transplant coordinator hat, or if not your social work hat on, is that I would coordinate a date. It would be on a Tuesday or Wednesday, or if not a Thursday and Friday. And that scheduled date, once it's concrete and it's something that the manager has accepted, and also the nephrologist saying we can move forward with this, is that they'll receive a packet 2 weeks prior at their dialysis unit. This packet includes instructions, patient handouts, sign-up sheet, a QR code flyer that they can pass out to their patient, and paper application. I wanted to limit a lot of these handouts, but unfortunately, because this is something that we want to make sure that all patients have the understanding that this virtual lobby day is a question and answer type of situation, or at the same time is how do we pursue it and how do we get them started. Patients will be given out a handout by their social worker, if not their transplant coordinator at the dialysis unit. If a patient is interested in receiving more information, they will actually receive their contact information, or the social worker will receive that information to be assigned a call time. And I'll give you an example of that of our call sheet a few slides later, is so you can actually visualize how this would work out. And lastly is that the social worker and transplant coordinator will send me that information prior to the virtual lobby day. Next. So here's the example of one piece of the information that I give in the packet. These are the staff instructions that will be given in the packet. It'll tell step by step what the social worker, if not the dialysis transplant coordinator, will have to do with regards to handouts, with regards to sign-up sheet, and at the same time is reassuring that all patients will be given a certain time that I would actually reach out to them. Next slide. And this is the virtual lobby day patient handout. And this, it says hangout, so that should be handout. I apologize for that error. But you'll see it to the left, it'll be English, and to the right will be in Spanish. And this is one sheet that's double-sided. There's questions with regards to questions that patients normally ask is that, am I a good candidate if I have any other medical conditions? How does the transplant wait list work? And so on. As you see all these questions there, and I know it's a little bit more difficult to see, but if you have an interest in seeing this handout, feel free to reach out to me and I can send you an example. And then the red spot and the red portion there, it actually goes over the sign-up piece. And next slide, please. So here's your patient sign-up sheet that's given also in this packet. I use myself as an example. I put my name. The dialysis center up top here would be if it's a FMC dialysis, or I'm sorry, a DaVita, or if not an independent dialysis unit. They'll also put the phone number of the patient, and they'll put down the date and time. I like to have 15-minute intervals. Believe it or not, 15 minutes sounds like a long time, but it's not. In some cases, I will speak to a patient that will run a little further with regards to timing, that maybe 30 minutes. And then also the video, or if not, they want a video, or if not, a phone call, and also comments. Comments example I have there is Spanish speaking. If there's any disability, I did have a gentleman who was visually impaired, and I needed to actually make sure that I didn't describe certain things of what would happen with him filling out a paper application, or if not, I would actually assist him with that. Next slide, please. So here's the QR appointment code. This is something, as I mentioned prior, is that we wanted this to be paperless. Some of you across the country may have this QR code for restaurants, limiting touch of menus. Here in Chicago, what it started off originally is that we did have a certain amount of restaurants open in the Chicagoland area, but we ended up having to retract that. But when the restaurants were open, they didn't want to give you a menu because of the fact of the issue or the risk of transmission. Is that the QR code? And I said, hey, why can't we do this also with the patient application? And what you do is that you would actually focus in onto that QR code. As you'll see, the next step is that there'll be a little bar on the top there that opens up our website. You'd actually press that website, and then to the right you'll see here it says step 3 is that the form would allow them to actually put their demographics, their insurance information, and what we'll do is that we'll give them a call. And above there, you'll see a little red text there. This talks about Android. Unfortunately, with iPhone, it's already built in. In some Android phones, you actually have to download an app. Next. So, part of the referral, and this is how it works when it comes to the virtual lobby day. Patients are called on their assigned time and date. Typically, it's on the Tuesday or the Wednesday, or if not the Thursday or Friday. I'll call the patient. We'll address certain things, concerns that they may have. If they don't have specific questions, I actually will go over the whole referral process. There is a lot of misconceptions with regards to fear of COVID-19, but also the fear of transplant. What does it entail? What is things that we look for? Talk about their family support, their support at the dialysis center, also about compliance. So in part of that discussion, once I discuss that, is that the patient will be asked at the end, is saying, would you want to pursue transplant? You'd be very surprised that a majority of patients, once that discussion is done, is that they're interested. Or if not, there may be certain things that they may not be at the exact time that they want to pursue it, but maybe the following month due to certain circumstances that they're dealing with. But if a patient's interested, there are a few ways to actually start the process at Rush. Is that they can complete a form, which I would complete a form over the phone, or they can actually work with the QR code, as you saw the example, or lastly is the paper application. Once all this transpired, is that I'll follow up with the social worker and the transplant coordinator and let them know the outcome of each patient. Is Mr. Jones or Mrs. Smith, are they interested in transplant and they're going to pursue it? We here at Rush actually are sticklers about timing and making sure that all patients are responded with their interest of a phone call within 48 hours. The referral form will be turned in, a schedule will review, and they will be informed as to next steps. The 48-hour callback, if there's any issues with their insurance or if not concerns about their medical history, they'll be informed during that phone call. Typically, a patient is scheduled within the 2-week period, but because of COVID, we've had to cut our appointments in half because of social distancing, so it's been beyond the 2-week period. Next. So the good news is that to date, I've actually completed 18 virtual lobby days, and it's been getting great success with regards to feedback from patients. In some cases, I may have 2 patients at a dialysis unit that would want to pursue it. In other centers, I've had 37 interested parties or patients that would want to pursue transplant. But here are some key pieces that I wanted to give you an exact quote from some of these patients. One patient acknowledged that, understanding and having the conversation about the workup made him feel more comfortable and confident of going ahead and scheduling an appointment. The other was that I didn't realize that in-person interactions with lobby days, in some cases, some patients feel anxiety of being questioned or actually receiving information in an open arena, is that this was more, they felt it was more personalized call, and they actually have their appointment scheduled for October. And lastly, which I thought was fabulous, is that I spoke to a patient a few months ago, and after 20 years of being dialysis, because of the COVID-19, it's convinced them to pursue transplant, which that is the consensus of a lot of patients, is that due to the pandemic, especially here in Chicago and the Chicagoland area, is that we're limited on a lot of outdoor activities, of accesses to restaurants. Right now, we're currently that there's no in-room dining of any restaurant. There's only takeout available in the Chicago and Chicagoland area. So I always explain to patients that this may be a good time to consider kidney transplant because they're limited on doing any of their activity. Is that why don't they work on themselves? Next slide. Next. So great. In conclusion, what we've seen is that technology can bridge the gap in providing transplant education to dialysis patients. This is a great time for patients to be encouraged to consider kidney transplant. The collaboration of the transplant center and their dialysis unit is critical in order for this virtual lobby day to be successful. If I don't have that social worker or transplant coordinator handing out these patient information, the patients won't actually have the opportunity to say, hey, this is something that I would want to get more information and have a phone call from John. Also, if your transplant center in your local area does not do a virtual platform for education, have them reach out to me. I can give them examples of what they can do, because it's very important that we actually assist each other in making sure we close that gap of getting that education to our patients. So I definitely encourage you to let me know if you have questions. And the next slide will give you my contact information. I hope this was informative. At the same time, it's something that we need to continue, and I want to thank you for your dedication. We know that dialysis never stopped a heartbeat, so to speak, with regards to the COVID-19. So I truly appreciate all your effort and your passion behind your work.
Thank you, John and Sini. That was excellent presentation. I do have a few questions that have come in, and I do want to remind everybody, please, if you do have any questions for either one of our presenters, so go ahead and send them through the chat or the Q&A. I had one question, John, just to clarify, your virtual lobby days that you're doing, I know you use Zoom or WhatsApp or different applications, but you still are doing one-on-one? You don't do any, like Zoom meetings? It could be more than one patient on at this point?
Correct. Yeah, at this point we do one-on-one, and the goal of the virtual lobby day, I'll give you an example, is that I had a patient who didn't want to do it during his treatment time, and he wanted to do it with his wife after hours. And, my schedule is some of us work remotely and some of us may work in center, or if not at the hospital, is that, I altered my schedule and I ended up doing a Zoom call with the family, and they were able to ask the questions freely. So this is the possibility that it could be more or less a group interaction with Zoom. That's a great idea if they have the ability. In some cases, because patients want that one-on-one, because there might be some personal information that they don't want to ask, or they get a little shy of saying, in front of a group, of kind of, so to speak, raising their hand and saying, I have a question that may not pertain to others, but it's personal for me.
Yeah, that's a good point. That's a good way to look at it. That actually, you bring up a very good point on that. So even hopefully post-COVID at some point, these will still be of value to your transplant program, and others. So, all right, well, this one question I think is really for both of you. It says, it's obvious that John and Sini really work together closely and frequently. Could you share the process that you guys have or communication tools that you use to keep updated on patients?
Yeah, I can go first, John. Is that okay?
Absolutely, Sini.
Okay. I'll give you an example with John. So our communication, we try to keep in contact with each other at least on a quarterly basis, the least we can. We do either contact through email, or sometimes we do it over the telephone, where we can just go through the process and see where the patients are. So that's how kind of my process has been with Rush, and then with the other transplant centers, I do either a lot of it has been like over the email process, or contacting them over the telephone.
So to piggyback on Sini is that, so with Rush specifically, and I'm a one-man show that I do the follow-up for the patient initial contact, and at the same time as the patient follow-up is where they're at and the status, if they're active, inactive, is I always encourage social workers, or not the transplant coordinators, is to pick a date in their calendar 4 times a year, is to reach out to their transplant center. For us at Rush, if Sini was to give me a call, I receive emails, daily where someone says, hey, I want to know who's actively listed on my transplant list. That's a great opportunity where I can actually pull up the patient. I can see where they're at in the process. You would be quite astounded at how many patients assume they're on the wait list when in fact they called and they're not on the wait list. So that's some clarification.
Correct, yeah. And so, Sini, back to you. Just do you use a tracking form to keep the patients listed and then where they are in the process?
Yeah, so we actually have a tool at Fresenius. We have a tool that they send out to us like on a weekly basis. It comes through to our clinic secretaries, and then the clinic secretary then distributes it to myself and also the clinical manager. So this is something that we look at. We also have documentation where we have to do what's called a transplant referral process. And we do that at least annually once a year, but also I update it as I have assessments as I'm doing, as we have our initial assessment, our 90-day assessment, and annual assessment. So kind of look and see if there's been any changes at that point as well.
Okay, great.
Just a little added piece to it. So what we do here at Rush is any virtual lobby day, or if not in center lobby day, we would provide the list of patients that are listed or even in the referral process at Rush. That's something that I would encourage, anybody working with their transplant or patients at their unit, is to encourage some type of education, but during that time is to incorporate, hey, give me an update. Give me an update of who's listed, who's not listed. Great.
Okay. Yeah. Great. It's clear that you both work together, and I think that's just a very important piece to make this successful. And even COVID or not COVID, it's just very important that you have that relationship with those facilities and transplant centers. Thank you. So, John, the question here has Rush Transplant Program, have you seen any overall increase or decrease in kidney transplant for 2020?
Actually, just kind of date it back, right? When COVID hit, we hit the brakes for kidney transplant, specifically between the months of middle of March up and through May, but then June. What we've seen is as soon as we opened up the first week of June is, yes, we've seen an increase. Unfortunately, because of this virus and week to week or day to day, week to week, and then month to month now, is we've learned as many scientists and doctors have learned about how this virus is transmitted and the risk of transmission, is that now we feel comfortable and we're doing more and more transplants. The good news is that because of the virtual lobby day and the education we're doing in our push, is we're seeing an uptick of referrals now. Is that right now we're booked in through almost February for our appointments, and even for myself from the virtual lobby perspective, I'm booked through the beginning of February specifically. And that's something that's good news, is that now the education of dialysis units and their staff, they're telling them, hey, we can continue on with transplant.
That's great to hear that. I'm glad it's finally getting back, and getting some momentum back again. Question for Sini. It asks, can you share some tips on what to say to patients that are hesitant to get a transplant referral during the pandemic?
Yeah, so as I mentioned, just kind of talking through with them and just, understanding, obviously they do have concerns that, they're already at risk because they're dialysis. So, it's just trying to understand, yes, where they're coming from, but also, you can start the process. It's still going to take a little time. And, they are doing certain things virtually, especially the virtual education. So I would say trying to encourage them that way. And of course, in the end, we do have to respect if a patient, like I mentioned, one of the patients, he didn't want to do it. So I said, okay, let me know when you're ready. So just kind of working through with them, I would say would be my best advice, and just encouraging them about the positive effects of transplant, versus that.
Right.
I want to piggyback on that. Is I think with Sini, in the way we've worked together, is that, if it's somebody who's interested in transplant, and Sini will reach out to me and I'll give them a call and say, hey, let them kind of have that discussion with the transplant center where they can kind of understand, because I always want to make every patient not feel pressured. We want to have an open discussion, and that's how you actually get those patients over that so to speak, hump. Of just saying, all right, this is where I can pursue transplant because I understand there's precautions that they're taking, all these measures. Because a lot of patients that I've interacted in person is that they hear it amongst others, is they create rumors of, oh no, I've heard this, I've seen this on TV. But I always tell them is that you really need to go to that transplant center that you're planning to work with and ask them what are the protocols that they have in place.
Right. Great. Exactly. Let's see. Actually, there is a comment there, John, in the chat. It says it's really just says, I wanted to share that John and I are currently working for a lobby day for next week, and I have to say there's a great turnout so far for the sign-up, and the one-on-one is definitely something that patients are looking forward to, and also the fact that they have both video and phone option has been great as well. So nice, a little shout-out to you, and it sounds like it is getting, like I said, some momentum, and you're building up, so that's good. And it sounds like you said you've already done 18. How do you plan on expanding your lobby days into the dialysis units?
Well, and that's kind of the word of mouth. At the same time, is I'm fortunate enough that I have more or less a list of social workers in the area where I'm going to send a mass email out and just encourage them just to consider it. Just like, for example, today I actually had 2 social workers that reached out to me and have scheduled it for February. And that's something that's important. I think amongst ourselves within the transplant community is that we need to continue that interaction with dialysis units and spreading the word that, hey, things are still going well with regards to, our programs, and, please let us know if there's specific questions. I had a patient today who, didn't want to kind of bother me, and I said, no, that's the point of me being available is to give you that information. And he put his daughter on the phone, and we did a call, and we kind of ironed out some of the questions that he had, and now they're moving forward with the potential opportunity that he could get a kidney transplant or be on that kidney wait list.
Great. Well, great. Well, I know it's just a few minutes before the hour, and I want to keep on schedule, so I think I'm going to go wrap it up. Again, thank you, John and Sini, for this presentation today, and I'm very happy to hear of some innovative ways to continue on with the transplant referral. This is really, really great news, and utilizing the technology that's already out there that we have that, to enable you to do those lobby days. So that's really great. Can I have the next slide? So we just kind of wrap up. A quick minute and a shout out to our flu vaccination toolkit that we have on our website. A lot of good information in there for providers that you can utilize. They have flu facts and taglines. We have social media content. There are some videos. There's materials you can print, on-demand training and educational events. So just visit ESRDNCC.org/flu. So a lot of good information. Next slide. And just again, we have some inspirational posters also on our website. They're evidence-inspired posters that you can, again, print, share in your dialysis facilities or your transplant facilities or places where you work. They do focus on psychological, physical health, emergency preparedness, and COVID-19. Next slide. And we also have the Kidney Hub. This Kidney Hub is a mobile-friendly web tool created with patients, for patients. They link to new videos, and helpful resources are continually being added to this hub. You can visit www.thekidneyhub.org today. You can see there's things on home dialysis, there's transplant, diet and nutritional resources are being added, COVID-19, of course. So we're always continually adding and updating this mobile app. And next slide. We just want to point out for our next COVID-19 webinar event, the patient-focused event will be January 5th, 4 p.m. Eastern Time. The next provider-focused event will be January 13th at 3 p.m. Again, you can visit kidneycovidinfocenter.com to register. These events are all listed already on there for you to register. And next slide. Just as a reminder, if you do want CEUs, please stay on the line. When I close out the event, you will be taken to a Survey Monkey. Please do the evaluation, and then you will be routed for your one CEU today. Again, I want to thank our presenters, Sini and John, for taking time out of the day, and everybody. Again, I know it's toward the end of the year. We're in a holiday week. I do really want to thank everybody for coming today. I want to say Happy New Year to everybody and hope that you will join us on a future professional COVID-19 webinar next year. Thank you, everybody, and have a good day.